a century, the BCG vaccine has been the world's primary defense against TB for children. However, adolescents and adults, the age groups that are most vulnerable to contracting and spreading TB, have been without a dedicated vaccine. Motsoaledi says the new vaccine that is still in a clinical trial could be the turning point.
In South Africa alone, we know that 80% of people who are HIV positive, 80% are actually killed by TB. That's the biggest killer of them all. So if we get a vaccine, it becomes a game changer because TB is treatable. It's a treatable disease, but it has been troubling the world for centuries, regardless of the fact that you can treat it.
Researchers are confident that the clinical trial will yield positive outcomes.
The M72 vaccine is a new TB vaccine candidate that is the most advanced of all the TB vaccine candidates that we're currently testing to use to prevent tuberculosis in the future. So this vaccine is at the moment in a clinical trial to test if it actually is going to work. We need the definitive answer, and for that we enrolled 20,000 people to see if the vaccine works. In this trial then, we give the vaccine to half the people and we give a dummy vaccine or a placebo to half the people and then follow the people up and see whether there is less TB in the group that got the vaccine versus not vaccine. So ultimately, hopefully, this vaccine will work. The preliminary results from earlier studies suggest that it is going to work.
A TB survivor turned activist is hoping for a breakthrough.
TB vaccine has always been a dream of mine, for one, because imagine now having something that can prevent from having TB. So this is a great start.
The World Health Organization says the introduction of a new vaccine will help to significantly ease the strain on the healthcare system.
We are still seeing a large number of cases for TB, mortalities as well. And these individuals present to health facilities. And of course, this also adds an additional burden to an already overstretched health system. So we really need to have new tools. We need to look at new innovative tools that can help bring down TB. And
mine workers, HIV positive individuals and individuals residing in underdeveloped communities are said to be among the priority groups to receive the vaccine if successful. SABC News, Johannesburg.